Hi, I'm Gwendolyn Boyd, and this is my Week 3 discussion post. The malpractice chapter in the textbook pointed out that the number of suicides for African Americans have recently increased, and I was surprised by this fact. Having a client that attempts suicide can be a very challenging experience. It is indicated that the counselor should not only rely on assessment or test results to determine if a client is suicidal, but should also use their observational skills. According to the law, counselors do not always have to be correct in assessing suicide risk, but it is legally required that the assessments are made from a knowledgeable position and their professional responsibilities are fulfilled in a way that is comparable to what other competent counselors would do in a similar situation. It is also important to maintain adequate documentation pertaining to the suicide assessment. Some of these items should include what caused the concern about the client, the questions that you asked the client and their responses, the specifics concerning the individuals that were consulted concerning the situation, and all pertinent information from the initial time of the concern until the work was completed. This documentation could also be essential in the case of a malpractice lawsuit. Speaking of malpractice, this is something else in this week's chapters that really caught my attention for obvious reasons. There were suggestions that were listed for avoiding malpractice. It is advised that the counselor restrict their practice to the area of their competency or the kind of counseling that they specialize in. Clients should not be allowed to run up a bill and then the counselor sue them, because they may countersue and base it on the counselor being incompetent. It is important to have a detailed and comprehensive disclosure statement. A counselor should never promise or suggest any outcomes or results. The counselor should make sure that firm boundaries are established and maintained with the client, and supervision should continuously be utilized for the counseling practice, even if it's just peer supervision.